Understanding ourselves is one of the difficult but important things to learn in order to know our existence here in this world. It narrows down all the information and description in different aspects of ourselves. Understanding the self will give us hints that will serve as a basis in order to clarify our existence, purposes, and how this information led us to what we have in our current days. There are so many individuals that gave their indifferent descriptions in understanding the self that will help us to understand ourselves. In other words, understanding ourselves will help us in all aspects that we have in our personality, body, identity, and especially to ourselves to know our importance in this world. But in this video, we will tackle about the self when it comes to sexual sensitivity, one of the aspects of self that will guide us and deepen our knowledge when it comes to the topic about sex, or must we call the sexual self. According to some researchers, the sexual self or the sexual self concept is defined as an individual evaluation of his or her own sexual feelings and actions. Hindi lamang tungkol sa sex ang nilalaman ng sexual self, kundi pati na rin ang mga aspeto na maaaring maiugnay dito kasama na ang sexual feelings or desires, sensitivity body parts, sexual behaviors, at syempre patungkol na din sa kalusugan ng tao na may kaugnayan patungkol sa sexual self. The sexual self will narrow down into 8 parts. First is the Sigmund Freud psychosexual stages of development. Second is the human reproductive system. Third is the erogenous zones. Fourth is the human sexual behavior or sexuality. Fifth is the physiology of human sexual responses. Sixth is the sexual problems. Seventh is the sexually transmitted diseases. And last is the natural and artificial methods of contraceptions. So let's tackle first about this Sigmund Freud psychosexual stages of development. But who is Sigmund Freud? Sigmund Freud is an Australian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through a dialogue between a patient and a psychoanalyst. According to the famous psychoanalyst Sigmund Freud, children go through a series of the psychosexual stages that lead to the development of the adult personality. His theory described how personality develop over the course of childhood. He believed that psycho-personality developed through a series of childhood stages in which the pleasure-seeking energies of the id become focused on certain erogenous areas. So what are the psychosexual stages of development? First is the oral stage. It is from birth to 1 year old. Infants' primary source of interaction occurs through the mouth. They derive pleasure from oral stimulation through gratifying activities such as tasting and sucking. During the oral stage, the baby gets much satisfaction from putting all sorts of things in its mouth to satisfy the libido and thus its id demands. Freud said oral stimulation could lead to an oral fixation in later life. So let's talk about the second stage, which is the anal stage. The anal stage is from 1 to 3 years old. The primary focus of the libido was on controlling bladder and bowel movements, dependent upon the way in which parents approach toilet training. Positive experiences during toilet training stage serve as the basis for people to become competent, productive, and creative adults. The third stage is the phallic stage. It is from 3 to 6 years old. Primary focus of the libido is on the genitals. Children also begin to discover differences between males and females. It is also the discovery of the Oedipus complex and the Electra complex, where Oedipus complex in psychoanalytic theory, it is a desire for sexual involvement with a parent of the opposite sex and a concomitant sense of rivalry with a parent of the same sex. It is a crucial stage in the normal developmental process. The Electra complex is the female equivalent of the Oedipus complex. They become unconsciously attracted to their father and develop hostile feelings towards their mothers, seeing them as their rival. The fourth stage is the latent stage or the latent period. It is from 6 years old to puberty. The superego continues to develop while the id's energies are suppressed. The children also began to develop their social skills, values, and relationships with peers and adults outside of the family. It is also the time of exploration in which the sexual energy are being repressed or dormant. Being fixated in this stage can result in maturity and an inability to form fulfilling relationship as an adult. The fifth and the last stage is the genital stage. It is from puberty until to death. The individual develops a strong sexual interest in the opposite sex. The goal of this stage is to establish a balance between various life areas. If the other stages have been completed successfully, the individual should now be well balanced, warm, and caring. These are the psychosexual stages of development according to Sigmund Freud. And these stages ay magsisilbing basehan kung paano at ano nga ba ang mga bagay na nakaka-impluwensya sa bawat yugto ng buhay ng tao para sa pag-develop ng tinatawag nating sexual self. Ang sunod na topic ay babahagi at tatalakayin ni Binibining Krisha Ang.
Human reproductive system. It is the reproduction in human being involves the fusion of male and female gametes producing the reproductive system. The male reproductive system is different from female reproductive system both in structure and in function. It also encompasses the male reproductive system, which is responsible for sperm production and deposit. There are 5 main parts of female reproductive system. First is the vagina. The vagina is a muscular, hollow tube that extends from the vaginal opening to the uterus. Because it has a muscular walls, the vagina can expand and contract. Second is the uterus. It is the hollow pear-shaped organ in a woman's pelvis. The uterus is where a fetus or unborn baby develops and grows. Third is fallopian tube. It connects the uterus to the ovaries. Fourth is the cervix. It is the lower, narrow end of the uterus that forms a canal between the uterus and vagina. And last is ovary. It is the 2 oval-shaped organs that lie to the upper right and left of the uterus. They produce, store, and release eggs into the fallopian tube in the process called ovulation. Vagina serves 3 purposes. First, it is where the penis is inserted during sexual intercourse. Second, it is It is the pathway through which a baby leaves a woman's body during childbirth. And third, it's the route through which menstrual blood leaves the body during periods. While in the male reproductive system, there are 7 parts. First is the penis, the male genital organ of higher vertebrates, carrying the duct for the transfer of sperm during copulation. In humans and most other mammals, it consists largely of erectile tissue and serves also for the elimination of urine. Second is scrotum. It is a thin external sac of skin that is divided into 2 compartments. Each compartment contains one of the 2 testes, the glands that produces sperm, and one of the epididymis where the sperm is stored. Third is the testes, one of 2 egg-shaped glands inside the scrotum that produces sperm and male hormones. It is also called testicle. Next is vas deferens. It is a fibromuscular tube that is continuation of the epididymis and is an excretory duct of the testis. Next is prostate. It is a gland that produces some of the fluid that carries sperm during ejaculation. The prostate gland that surrounds the urethra, the tube through which urine passes out of the body. And last is seminal vesicle. It is a pair of 2 convoluted tubular glands that lie behind the urinary bladder of some male mammals. They secrete fluid that partly composes the semen. These organs do the following jobs to your body. First is they produce, maintain, and transport sperm and semen. Second, they discharge sperm into the female reproductive tract. And third, they produce and secrete male sex hormones.
Erogenous zones refers to parts of the body that are primarily receptive and increase sexual arousal when in touch in a sexual manner. It may vary from one person to another. Some people may enjoy being touched in a certain area more than the other areas. Erogenous zone is about sa parte o sensitive part ng isang tao kung saan mas nagkakaroon ng malaking factor sa isang tao upang masatisfy at mag-lead ito sa anumang sexual behavior. Here are some parts of our body that we can consider as erogenous zone. Mouth, breast or nipple area, genitals, anus. Other parts are neck, thighs, abdomen, and feet. Let's go to human sexual behavior and sexuality. It is defined as any activity solitary between person or in a group that includes sexual arousal, according to Gebhard PH 2017. It refers to people's sexual interest in and attraction to others. It is the capacity to have erotic or sexual feelings and experience. Human sexual behavior is kung paano or gaano kataas ang interes ng isang tao pagdating sa isang sexual activity or kung paano sila naa-attract sa isang tao. Sexuality may be experienced and expressed in a variety of ways, including thoughts, fantasies, desire, beliefs, attitude, values. Ito yung pagdating sa mga bagay na to is matatawag natin na imahinasyon or yung temptation natin sa isang tao kaya natin nagagawa ang isang sexual activity. Practices, roles, and relationship is yung kung ano yung relasyon natin sa isang tao, kung bakit natin magagawa ang isang sexual activity. There are 2 major factors that determine human sexual behavior: inherited sexual and degree of restraint. Inherited sexual responses pattern that have evolved as a means of ensuring reproduction and that became part of each individual's genetic inheritance. Inherited sexual is nasa genes na or nasa lahi na yung pagiging sexual active. So mas nagfa-factor sa isang tao na magiging sexually active siya dahil nasa lahi na nila ito. Next is degree of restraint. Degree of restraints or other types of influence exerted on the individual by society in the expression of the sexuality. Degree of restraint is yung influence ng isang tao or sa panahon ngayon is influence ng social media. Mas napapataas or mas nagiging active ang isang tao pagdating sa sexual activity dahil sa impluwensya ng kung sino man. Let's go to the types of behavior. There are two types of behavior. The solitary behavior and the social sexual behavior. Solitary behavior is isang tao lang ang involved or pwede rin natin itong matawag na masturbation. Normally, puberty is mas nagkakaroon ng curious ang isang kabataan kaya nangyayari itong bagay na ito. Kaya mas nasusubukan nila ang masturbation. Social-sexual behavior. Ito naman is dalawa or mahigit pang tao ang involved. Ito yung tinatawag na natin na sexual activity sa pagitan ng dalawang tao or ng partner. So, sa kabuuan, pag sinabing solitary behavior, isang tao lamang. Pero pag sinabing social sexual behavior, is dalawang tao or higit pa ang involved.
Psychology of human sexual response. Sexual response follows a pattern of sequential stages or phases when sexual activity is continued. The sexual response cycle has 4 phases: excitement, plateau, orgasm, and resolution stages. Number 1, excitement stage. First stage of the human sexual response cycle occurs as a result of any erotic, physical, or mental stimulation such as kissing, eating, or viewing erotic images that lend to a sexual arousal. Number 2, plateau stage. Second phase of the sexual cycle after excitement. It further increases in circulation and heart rate occur in both sexes. Sexual pressure increases with increased stimulation. Muscle tension increases further. Intensifies the responses from the excitement phase. Breathing, blood flow, and heart rate continue to increase and stabilize. Number 3, orgasm stage, sexual climax. Third phase of the sexual cycle after plateau phase. Conclusion of the plateau stage and a release of sexual tension, characterized by involuntary actions. This phase is the climax of the sexual response cycle. It's the shortest of the phases and generally lasts only a few seconds. Number 4, resolution stage. Last phase of the sexual cycle after orgasm phase. It refers to the return to a normal or subnormal physiologic state. It allows muscles to relax, blood pressure to drop, and the body to slow down from its excited states. During resolution, the body slowly returns to its normal level of functioning, and swelled and weak body parts return to their previous size and color. This phase is marked by a general sense of well-being, enhanced intimacy, and often fatigue.
Good day everyone, my name is Erica Adino and I will be the reporter for this topic, which is sexual problems and 5 types of sexually transmitted diseases or STDs. So, ang pagkakaroon ng kawalan ng sexual intimacy sa mga magkarelasyon ay isang nagpapakita kung gaano ka-healthy yung relationship na meron sila. Pero hindi naman porke sexually active yung magkarelasyon is masaya na or healthy yung relationship. Hindi po nakadepende yung status ng relasyon ng magjowa or mag-asawa sa sexual intimacy or activities nila. Sexuality is also an important part of self-esteem. Dahil dito, nabubuo yung confidence na dapat meron yung isang tao. Ang sexual self-esteem natin ay nakaka-impluwensya sa halos bawat desisyon na ginagawa natin sa buhay. mula sa kung kanino ka nakikipag-ugnayan at kung kailan mo pinipigilan ang iyong sarili sa mga desisyon na alam mo namang hindi naman tama. Sinasabi dito na ang babae at lalaki daw ay may differences o pagkakaiba. They have this pride of themselves on their fertility at yung kapasidad nila sa sexual activity. Magkaiba din ang babae at lalaki base sa kanilang katangian or attractiveness sa kanilang sexual partners bago at pagkatapos ng kanilang aktual na pagtatalik. However, yung mga magjowa at mag-asawa daw dyan na may sexual problems at mga incompatibilities ay nagiging dahilan or nagkakaroon ng hindi magandang effect sa kanilang relasyon. Dito lumalabas kung paano yung pagtrato o nararamdaman nila sa kanilang partners. So sinasabi dito na kapag may sexual problem ka ay maaaring makadamay ito sa iyong psychological, psychological, at social in origin. Ang psychological daw ay ang pinakamababa dito sa tatlong kategorya. Kaunti lang yung mga taong nagsasuffer sa mga sakit na ganito. Halimbawa ay dahil na din sa hindi normal na pagdevelop ng kanilang genitalia o yung kanilang ari, or dahil na din sa mga parte ng kanilang neuropsychology na nagkokontrol ng kanilang sexual response. Sa kabutihang palad, yung mga majority of psychological sexual problems ay naaagapan naman through medication or surgery. Pero yung mga problems ng nervous system na nakakaapekto sa sexual response ng isang tao ay mas mahirap na lunasan or agapan. Samantala, ang psychological problem naman ay yung pinakamataas o malaking category out of these three category. They are usually caused by socially induced inhibitions na ang ibig sabihin ay isang epekto ng lipunan at yung mga kasabihan tungkol sa sexualidad na palagi nating naririnig sa mga nakakatanda o yung mga taong nakapaligid sa atin. Ang halimbawa ng sexual myth is yung paniniwala nila ng isang good and mature sex must involve rapid erection or yung mabilis na pagtigas ng ari ng lalaki at prolonged coitus or yung matagal na pakikipagtalik. Kadalasan nating naririnig yung mga paniniwala na ganito sa mga nakakatanda or nababasa natin sa mga magazine, mga marriage books, pero hindi naman palaging nangyayari yung ganito sa magkarelasyon or sa totoong buhay. Therefore, isa ito sa mga dahilan kaya nagiging negative yung pag-iisip ng magkarelasyon in a way na nagbibigay sa kanila ng anxiety and guilt kasi hindi nila nabigay or hindi nangyari yung mga kasabihan na pinaniniwalaan nila. Nagre-resulta din ito ng negative emotions sa bawat magkarelasyon na nag-e-effect sa kanilang behavior. Social problems are much likely the effects of psychological and psychological problems.
Oh, don't worry, you can't get infected. It's only... my allergies.
Sexually transmitted diseases, or STDs, are diseases, infections, or illnesses that can be spread from a person with an STD to another through sexual contact. That includes genital-to-genital contact, which is contact with penises, scrotums, vulvas or vaginas, to any kind of sex, oral, anal, or vaginal sex. Some STDs are fairly common, so there's nothing to be embarrassed about if you ever get one. Some STDs do not cause any symptoms, so many people who have an STD do not know it and might spread it. For those who do have symptoms, they may experience soreness or swelling around the genitals, bumps, sores, or rashes on the genitals, itching, burning, or pain while urinating, and girls may get a vaginal discharge that is different from normal. If you have any of these symptoms, or if you've had unprotected sex, it's important to get tested for STDs. STD tests differ. Some are blood tests, some test urine, and still others use a swab of saliva or a discharge. Even if you use protection, it's a good idea to get tested for STDs at least once a year. You can get an STD test from your healthcare provider or at a family planning or STD clinic. Some STDs can be cured while others cannot, but their symptoms can be managed with medication. Some STDs, if left untreated, can cause serious health problems later in life. So remember, once a person becomes sexually active, it is important to use condoms and other latex barriers and to get tested for STDs regularly.
So the first type of STD is human immunodeficiency or HIV. It is a virus that attacks cells that help the body to fight infection, making a person vulnerable to other infection and diseases. You can get HIV from contact with infected blood, semen, or vaginal fluids. Most people get the virus by having unprotected sex with someone who has HIV. Another common way of getting it is by sharing drug needles with someone who is infected with HIV. So madaming nagtatanong kung makakakuha ka daw ba ng HIV because of kissing someone. And the answer on that question is no. Because as I've said, HIV spread through exchanging body fluids such as blood, semen, and vaginal fluids, but not saliva. You can become infected with HIV through ordinary contact. So what are the symptoms of HIV? The symptoms are fever, rash, night sweat, sore throat, fatigue, and swollen lymph nodes. Next is acquired immunodeficiency syndrome or AIDS. It is the last stage of HIV infection. Yung virus na to is usually targeting the T cells or yung tinatawag na CD4 cells ng immune system natin, which serves as the regulators of the immune system. The virus survives throughout the body but may be transmitted via body fluids such as blood, semen, vaginal fluids, and breast milk. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. The common symptoms of AIDS are fever, sweats, chronic diarrhea, swollen lymph glands, persistent unexplained fatigue, weakness, weight loss, and skin rashes. Take note that you can catch HIV or AIDS by hugging, kissing, dancing, or shaking hands with someone who has the infection. Aside from HIV and AIDS, may iba pang sexually transmitted diseases or STD na pwedeng makuha ang isang tao. The following list of diseases is based on Sexually Transmitted Disease Surveillance 2016 of the U.S. Department of Health and Human Services Center for Disease Control and Prevention. So the first one is chlamydia. It is the common sexually transmitted infection caused by bacteria. It is caused by bacteria called Chlamydia trachomatis. It can infect both men and women. Women can get chlamydia in cervix, rectum, or throat. Chlamydia is a bacterial infection. The bacteria are usually spread through sex or contact with infected genital fluids such as semen or vaginal fluid. You can get chlamydia through unprotected vaginal, anal, or oral sex. Pregnant women can give it to their unborn children during delivery. Infection rates are highest among younger women, with the highest rates of infection occurring in women between ages 15 and 24. Ito yung mga symptoms para sa mga babaeng may chlamydia. Pain when urinating, pain during sex, bleeding after sex, pain in tummy or pelvis, and unusual vaginal discharge. Habang sa mga lalaki naman, ang sintomas na nararamdaman nila ay pain when urinating, white or cloudy or watery discharge, and pain in the testicles. Second is gonorrhea. Gonorrhea most commonly spread during vaginal, oral, or anal sex. Gonorrhea infects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men. You can get infected when the bacteria enter your body through the penis, anus, vagina, or mouth, often during unprotected sex. You can also get or pass gonorrhea through sharing sex toys that haven't been washed or covered with a new condom. What are the symptoms of gonorrhea? The symptoms are painful urination, vaginal bleeding, plain or swelling in one testicle, abdominal or pelvic pain. Third is syphilis. The most common way syphilis spread is through contact with an infected person's sore during sexual activity. The bacteria enter the body through minor cuts or abrasions in the skin or mucous membranes. Syphilis can be spread by toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shed clothing, or eating utensils. These syphilis symptoms may come up and go for up for 2 years. They include body rashes that last 2 to 6 weeks, often on the palms of your hands and the soles of your feet. There are a lot of other symptoms including mild fever, fatigue, sore throat, hair loss, weight loss, swollen glands, headache, and muscle pains.
The sixth is herpes simplex viruses. Herpes simplex viruses is among the prevalent or sexual transmitted infection. Although most infections are subclinical, clinical manifestations are characterized by recruitment. The herpes simplex viruses, also known as HSV, is an infection that causes herpes. Herpes can be appear with the virus part of the body, most commonly on the genital or mouth. Cause of herpes simplex viruses is a contagious virus that can be transmitted to person through direct contact. Children will often contact from early contact with an adult who has an infection. They can carry the virus from the rest of their living lives. Last is Trichomonas vaginalis. Is a common sexual transmitted protozoal infection associated with adverse health outcome such as preterm birth and symptomatic vaginitis. Trichomonas vaginalis is a bacteria infection that causes implementation of vaginal mucosa accompanied by unpleasant urine discharge.
Natural and artificial methods of contraception. The natural method. The natural method does not involve any chemical or foreign body introduction into the human body. People who are very conscious of their religious beliefs are more inclined to use the natural way of birth control and others follow, such as natural methods, because they are most cost effective. There are several examples of using natural methods. First is the abstinence. The second one is the calendar method. The third is the basal body temperature. The fourth example is the cervical mucus method. The fifth one is the symptothermal method. The sixth example is the ovulation detection. And the last example is the coitus interruptus.
Now, let's talk about the artificial methods of contraceptions. What is artificial methods? Artificial method it is commonly used objects or chemicals that may intake by a person to prevent any harm in the body during sexual activity. It says things that a person or a couple is used to try to avoid pregnancy. Like in family planning, meron tayong tinatawag na artificial methods, which is ito yung way or pamamaraan upang maiwasan ang pagbubuntis ng isang babae or even sa mga mag-asawa na gusto munang mag-awat sa panganganak. Number 1, oral contraceptives. Ito yung pills na iniinom ng mga kababaihan. It will contain hormones which called estrogen and progesterone na nagpe-prevent ng pregnancy. Pinipigilan nito ang ovulation ng isang babae or pinipigilan nito or nililimitahan ang pagpasok ng sperm sa ova ng babae. And based on my research, ang pag-take ng pills ay unang linggo pagkatapos ng kanyang buwan ng dalaw. May iba't ibang epekto ang pag-iinom ng pills. Meron sa pagtatalik at meron din sa pagpapasuso ng bata. And syempre, ang mostly na reason ay kung ikaw ay isang nanay na may baby or nagpapasuso ka ng bata, hindi mabisa or hindi pwede sa'yo ang pag-take ng pills. 2. Transdermal patch. It will contain also ang hormones which called estrogen and progestin na ina-apply sa skin ng babae. Ang gamot na nilalaman ng transdermal patch ay ina-absorb ng balat papunta sa daluyan ng dugo ng isang babae. To prevent pregnancy, ina-apply ito every weeks in 3 weeks sa mga upper part ng katawan, maliban lang sa mga skin na mabilis ma-irritate. And syempre, it works the same way by preventing the releasing of an egg or the ovulation. Number 3, vaginal ring. Ang vaginal ring ay silicone na bagay na ini-insert sa reproductive organ ng babae. Ito ay nakapaligid lang sa cervix niya and nagre-remain ito ng 3 weeks and tinatanggal kada 4th week na kapag dadatag na ang isang babae. Siyempre, kapag sa paraang tinanggal na ito, pwede na ulit magbuntis or pwede na ulit magbuntis ang isang babae or tinatawag na fertile. Number 4, subdermal implants. Ini-insert ito sa ilalim ng balat ng babae sa kanyang braso to prevent pregnancy. Itsura nito ay parang tinusok ng nakarayom na kulay white na plastic, pero may nilalaman din siyang gamot which is yung hormones. And tumatagal ito ng 3 hanggang 5 taon. Minsan naman may mga babae or mga nanay na kakapanganak pa lang nila sa ospital, nagpapalagay na sila agad ng ganito para ma-sure na hindi na talaga muna sila magbubuntis. And syempre, ang paglagay ng ganito ay nakakatulong din or nakaka-prevent din na mag-release ng eggs or mag-release ng sperm to or papunta sa egg ng babae. Number 5, hormonal injections. Ito ay ini-inject sa isang babae isang beses kada buwan or every 3 months. Ito rin ay naglalaman ng nasabing hormones which is yung estrogen and progesterone na pumipigil na mag-release ng egg. And syempre, nakakatulong ito na mag-thickens ng mucus at the cervix. Pwede rin itong ipatanggal ng isang babae once na gusto niya na ulit magbuntis or mag-anak. Number 6, intrauterine device. Ito yung small T-shaped object na naglalaman ng progesterone na ini-insert sa uterus ng babae. Siyempre, to prevent pregnancy or to prevent fertilization. Based on my research, ang contraceptive device na ito ang may pinakamatagal na epekto sa babae, which is umaabot ng 5 to 7 years. And pinapalagay ito after ng kanyang buwan ng dalaw. Number 7, chemical barriers or tinatawag na spermicide or sperm killing. Ito yung vaginal suppositories or mga I think cream, gano'n, na ilalagay sa ari ng babae bago sila magtalik ng couple bago mag-sexual intercourse. This contraceptive provides the chemical barriers to the sperm by trapping or damaging the sperm. And syempre, itong chemical barriers na to ay hindi nakakapag-prevent ng possibility mangyari sa inyo na magkaroon ng sexual transmitted infections. Number 8, diaphragm. It is a circular and rubber disc that is placed over the cervix with spermicides before sexually intercourse. And iiwan mo lang siya in place for at least 6 hours after ng pagtatalik ninyo. Number 9, cervical cup. Ito po yung rubber lang na style niya is parang sombrero or yung imbol na nilalagay sa ganito kapag mananahi ka para di ka matusok ng karayon. Yung ganun po. Ganun yung itsura niya and nilalagay siya sa cervix ng babae to cover it. And ang kayang i-stay lang ng cervical cups or dapat na itatagal niya sa cervix ng babae is hindi lalagpas or hindi aabutin ng 48 hours. Number 10, male condoms. Alam naman siguro natin lahat kung ano ang condoms. Ito ay ginagamit ng mga kalalakihan bilang protection or para ma-prevent ang pregnancy or to trap the sperm during the ejaculations during the sexual intercourse. Ang condom ay mabibili mo lang siya sa over the counter or like sa 7-Eleven, ganon. And natutulungan din itong ma-prevent ang infection na or tinatawag na STI, which is sexually transmitted infections. Number 11, female condoms. It is a latex rubber that are pre-lubricated with spermicides. Pareho lang din siya ng male condoms, but ang pinagkaiba nila is may parehong ring kabilaan. Yung isang ring is tinatawag na outer ring kung saan ayun yung nakalitaw dun sa may pag pinasok mo siya sa reproductive organ. And yung isa is yung inner ring na nagpo-cover sa cervix ng babae. And syempre, ang purpose din nito is to prevent or limit the fertilization of an egg. And last, number 12, surgical methods. Dito ginaganap ang tinatawag na ligate or tubal ligation. Ang tubal ay yung fallopian tube ng babae. Ang tubal ligation or ligate ay ang pagputol or pagtali sa fallopian tube ng babae para sure na hindi na talaga siya mabubuntis. And sa isang nanay, maaari lang siyang mamili sa dalawa, either ipapatali or ipapaputol na talaga para sure. Kasi kung itatali mo lang siya, maaari pa siyang mag-reverse na pwede ulit or may possibility ulit na maging fertile yung babae. Pero kung ikakat mo naman, ayun yung sure na talaga na hindi ka na talaga magbubuntis. And base sa na-research ko, ang nire-recommend talaga ng mga doktor is yung ikakat na para hindi ka na talaga mabubuntis. And mostly ginaganap yon or ginagawa yon sa ospital mismo after manganak ng isang babae.
So that's all for our report. I hope you learned something from us. So thank you for listening and have a nice day.